What are the risk factors for lymphoma? Can you fully recover from lymphoma? Lymphoma treatment cost in India. Hello friends, myself Dr. Swagat Dash. I am the head of the Department Nuclear Medicine at Sarvodaya Hospital, Faridabad. Today we will be discussing about lymphoma. What is lymphoma? Lymphoma is basically a cancer of the lymphatic system. What is that lymphatic system? Lymphatic system constitutes lymph nodes, spleen, thymus and other lymphoid organs. So when there is a cancer which has been developed in these or any of these lymphoid organs, we called it lymphoma. Then what are the risk factors for lymphoma? As such, medical science doesn't know any one risk factor. It may be age. Usually older age people or younger age people, they are affected more than middle-aged people. Sex, male are more affected than female. If there is any disorder of the immune system, then also lymphoma can be developed. And there are certain infection, viral infection like Epstein-Barr virus or Helicobacter pylori. This is a bacterial infection. These two infections, they can cause lymphoma in a patient. Then what are the signs and symptoms of lymphoma? Usually lymphoma patients, they present with fever which has been persistent since more than 1 month almost. Other causes of the fever, they are not being diagnosed or they are all ruled out. The exact cause of the fever is not known. Night sweat, extreme weakness, weight loss and many times swelling along the neck or armpit or in the groin area. We call this lymph nodal swelling. So now how lymphoma is diagnosed? Basically, diagnosis of lymphoma depends upon either this lymph nodal swelling biopsy or from bone marrow biopsy. Once the diagnosis is being made, then you will be asked to undergo a FDG PET-CT scan. Basically, FDG PET-CT scan gives you the exact burden of the disease in your body and what is the stage. After that, the treatment starts. The most common treatment modality is by chemotherapy. However, radiation therapy, immunotherapy, other targeted therapy, they may be also required in certain patients. These treatment modalities will be discussed with you by your medical oncologist. So you need to discuss all the treatment modalities, what is the pros, cons and what will be the prognosis with your treating medical oncologist. Prognosis of the lymphoma, they depend on various factors. First is type of lymphoma. Usually the lymphoma is broadly of two types, Hodgkin's lymphoma and non-Hodgkin's lymphoma. Again, non-Hodgkin's lymphoma are various types. Few are high-grade lymphoma and few are indolent or low-grade lymphoma. Usually Hodgkin's lymphoma has a better prognosis than non-Hodgkin's lymphoma. And among non-Hodgkin's disease, usually the indolent lymphomas have better prognosis than high-grade lymphoma. Then next factor is stage at diagnosis. At what stage lymphoma has been diagnosed? If the lymphoma has been diagnosed at a very early stage, then usually the prognosis is very good. Another factor is response to the initial treatment. If the patient is responding very well to the initial line of treatment, usually the prognosis is going to be better. Then average general health of the patient. Usually young patients who are good at health, they tolerate the lymphoma treatment better and they have a good prognosis. However, you have to keep in mind that the prognosis will vary from person to person, from lymphoma to lymphoma, and they are not always predictable. Can you fully recover from lymphoma? My answer is yes. If it is diagnosed at an early stage with treatment is being given and patient is regularly following up with his treating oncologist, then patient can definitely fully recover from lymphoma. What will happen if you ignore your lymphoma? If lymphoma in body has already been developed and it is being ignored, then the symptom of the patient will increase. Like usual symptoms of the lymphoma are fever, night sweats, weakness, weight loss and swelling along the neck or armpit or groin. So all the symptom will increase. Patient will develop extreme weakness. Number two, As I had already explained, lymphoma usually involves the lymphoid organs, but as the disease is progressing, it may involve other organs as well, like your liver, your kidney, your lungs, they may be affected, and there may be organ dysfunction. So basically, if lymphoma is being ignored and is not being treated, then it becomes a multi-system disease and ultimately organ failure ensues and there may be untimely death. What is the most common treatment for lymphoma? The most common treatment modality is chemotherapy. Chemotherapy, these are cytotoxic drugs. They are usually being given as injections, and usually the chemotherapy regimen, it consists of 6 cycles of chemotherapy with a 3-week gap in between. This is the most common treatment line. In some patients, they may require radiation, that is external beam radiation. Some other patient may require immunotherapy. This is another modality. And the last modality will be bone marrow transplantation, which can completely cure the patient of lymphoma. The last modality is radioimmunotherapy, that is RIT. Basically, what happens in this treatment, the immunotherapeutic drug is being attached to a radioisotope, that is a therapeutic radioisotope, and this drug is being injected to the patient. When it gets internalized, patient gets internal radiation. So all the lymphoma cells in the body, when they get internal radiation, they get killed, and likewise patient may respond to the treatment. The treatment modalities for lymphoma in adults are most commonly is chemotherapy, then immunotherapy, targeted therapy, bone marrow transplantation. However, in certain cases where the high-grade lymphomas like diffuse large B-cell non-Hodgkin's lymphomas, they are not responding to the usual line of treatment. In such scenarios, radioimmunotherapy can be another modality where the immunotherapeutic drug is being labeled to a therapeutic radioisotope and injected to the patient, which gives internal radiation, and the lymphoma cells, they get killed. Success rate of treatment in lymphoma. Hodgkin's lymphoma, 5-year survival is more than 90%. However, in non-Hodgkin's lymphoma, 5-year survival is almost 80%. In non-Hodgkin's lymphoma as well, there are high-grade lymphoma like diffuse large B-cell lymphoma, mantle cell lymphoma, Burkitt lymphoma, and certain indolent lymphoma. Usually, high-grade lymphoma 5-year survival is approximately 80 to 85%, and for indolent lymphomas, 5-year survival is 96 to 100%. Now coming to Hodgkin's lymphoma. Hodgkin's lymphoma has a 5-year survival of more than 90%, as I have already said. Then again, the treatment response or treatment effect, it depends on the stage of lymphoma. If the lymphoma is being detected in early stage, then the treatment response are almost 90 to 100%. Another is patient body condition. If the patient is young and patient is healthy, the success rate are very, very high. However, in advanced lymphoma, when that means the lymphoma has spread beyond the lymphoid organs to other organs like liver, lung, spleen, or kidneys, then success rate of treatment decreases, and it is somewhere around 70% of 5-year survival rate. Treatment of early stage lymphoma or stage 1 lymphoma. You have to see whether the lymphoma is a high-grade lymphoma or indolent lymphoma. If it is indolent lymphoma and the area of involvement is less, then your doctor may ask for active surveillance. That means no treatment is being given to you and you will be called for frequent follow-ups. Doctor will observe you, and if need arises, then the treatment will be instituted. The next and most common treatment regimen will be chemotherapeutic regimen. These are basically cytotoxic drugs. These are being given as injections and they kill lymphoma cells. Then other modality is radiation therapy. Usually the bulky lymph nodes, they are being killed by external beam radiations, which are basically X-rays. Then other modality is immunotherapy. Immunotherapy, what it does, basically it activates your body immune system, and that activated immune system fights the lymphoma cells. The last but not the least, there will be bone marrow transplantation, where the existing bone marrow, which are the diseased bone marrow, they are being replaced by fresh and healthy stem cells. This is called bone marrow transplantation. Lymphoma treatment cost in India. Basically, the treatment of lymphoma in India is very affordable. Whether be it diagnosis, the FDG PET CT scan, and the actual treatment protocol, they are very reasonably priced. Mostly you can expect anywhere between 15 to 20,000 US dollar for the entire duration of your treatment. This will be the actual cost actually. But this cost you need to keep in your mind will vary from region to region, hospital to hospital, and doctor to doctor.